Hello and welcome. My name is Alex Bushell, and this is my portfolio rationale for Foundations of Chiropractic 1, Semester 1, Year 1. So basically the first thing I'm going to talk about is philosophy. Why did I choose to get into chiropractic and what I think it means? First and foremost, it's to help people. I once had a conversation with someone who was entering into the healthcare profession along myself when I was a massage therapist, and what concerned me was that the first thing that this person said was, I'm in it for money and prestige, and I basically said to him, I said, well, what happens when you have the money and you have the prestige? What's going to keep you in the industry? And the fact that if you're not in this to help people as your first and foremost goal, then you probably shouldn't be in it. So that's where I'm coming from. If I treat from my heart, use my head along the way, then the hip pocket and the money will come. So my journey has just begun in the realms of chiropractic, and throughout this term I've learned some really critical skills to put me on along that pathway. So palpation, biomechanics, anatomy, physiology, and knowledge, and postural analysis and muscle testing. One of the biggest things which I came across within this semester was that we were learning the skills, but the why behind we did them, I'm sure will be laid in very shortly. So I'm really sort of chewing at the bits to get my mind wrapped around the why we do things, to put it into a clinical perspective, so that when someone presents with something, then you say, okay, well, I've got this drop down list of these tests that I can do to then differentiate and diagnose the correct treatment for the clientele. So I'm really excited to get myself into those skills and learn the why behind what we do. The role of chiropractic within the Australian healthcare system, it is something which is it's a natural alternative. It is drug free, and I think it needs a lot more education. If people knew more about what chiropractic does and what can do for them, then I think that we can really help the healthcare system that's inundated right now, because people don't know what professionals to go and see for what issues and what problems. Hence you see emergency waiting rooms full. You see GPs seeing a couple hundred people a day and then having to refer out. Same thing with things like physios. It seems as though a lot of time they try to refer out to other people like massage therapists, remedial therapists, musculoskeletal therapists, because they need to get their hands onto the critical sort of patients, if you will. So I think education is a big thing. So teaching people why you're treating them in a certain manner, and helping them understand their body a bit more as a key step. So when you ask them to do something like some homework, some exercises, some nutrition, which are all sort of three key areas to health, then they're more likely to go and do it, because they understand why they're needing to do it rather than just being told to do it. So chiropractic should be educators. Historically versus modern chiropractic, I've read that there's a lot of change that has happened within the industry. It is a growing industry. It's still a young industry. Differences in law, as what we can and cannot do, who we can and cannot see, that forms our scope of practice. One of the biggest issues that came to light recently was the interview with Dr. Ian Rossborough and his treatment of a 4-day-old baby. I think that we should be able to treat such patients, but again, the why needs to be educated on. There needs to be more research and trials to make it a more evidence-based industry and profession. So I'm really excited on the first steps of my journey into the chiropractic world, and I can't wait to see what the coming semesters and years will show, and what I will learn and who I'll become and develop into. Thanks very much.